In my talk, I'm addressing the role of non-alcoholic fatty liver disease as a risk marker for type 2 diabetes and cardiovascular disease. In addition, I will also address what may be the best pharmacological but also lifestyle intervention to treat non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease became a major problem during the last decades. In about 30% of the adult population in the industrialized countries has non-alcoholic fatty liver disease. It is certainly a major problem for hepatic diseases like hepatic failure, liver cirrhosis, but more importantly, most patients with non-alcoholic fatty liver disease develop type 2 diabetes and may die more early of cardiovascular disease. So the question is it relevant to identify non-alcoholic fatty liver disease? Second, is it relevant to separate it from other problems like obesity and visceral obesity? And third, what would be the best treatment options in these patients? So first, non-alcoholic fatty liver disease is an independent predictor of type 2 diabetes and cardiovascular disease, meaning that in isolation, high liver fat content that can be measured by ultrasound, but also by more advanced techniques like CT and magnetic resonance spectroscopy, predicts an early development of diabetes and cardiovascular disease. So it is an independent marker. The question is, are there different stages? Certainly there is the simple steatosis, but few people develop fibrosis and liver cirrhosis, and there the risk not only of liver disease but also of cardiovascular diseases increases. And then the question is, what is the best treatment if non-alcoholic fatty liver disease is present? So in the simple stage where there's no inflammation, lifestyle intervention is the most effective treatment, and with a weight loss of about 5 to 8%, liver fat content decreases by about 40 to 50%. So the question is, does it also decrease inflammation and fibrosis? And the answer is yes, but not that strong as the decrease in liver fat is being observed. So what it would be pharmacological options to treat non-alcoholic fatty liver disease? In the moment, the most promising approach is pioglitazone. It is not approved for the treatment of non-alcoholic fatty liver disease. However, in a large number of randomized controlled trials, pioglitazone proved to be the very, let's say, most effective treatment approach. It decreases not only liver fat content but also inflammation and has a mild effect on fibrosis. And then there are the GLP-1 agonists, and GLP-1 agonists like, for example, liraglutide was tested, effectively reduces liver fat content in a small study and also improves inflammation. So there is hope that the GLP-1 agonists, like, for example, liraglutide and others, may be good options to treat people with non-alcoholic fatty liver disease. And lastly, there's the question how to treat fibrosis. That's more critical at the moment, and their immune modulatory functions and drugs attacking or addressing the immune system appear to be promising. However, these data are in a very early stage of research.